patients without comorbidities? A. Azithromycin, B. Amoxicillin, C. Levofloxacin, D. Ceftriaxone, E. Doxycycline. Answer B. Amoxicillin. Explanation. Our X-Files highlights high-dose amoxicillin as first line for CAP outpatients without comorbidities. Doxycycline or macrolides can be alternatives depending on resistance. Fluoroquinolones and ceftriaxone are reserved for more severe cases. Q2. Which antifungal requires monitoring of liver enzymes due to hepatotoxicity risk? A. Fluconazole, B. Terbinafine, C. Nystatin, D. Amphotericin B, caspofungin. Answer B. Terbinafine. Explanation. Oral terbinafine for onychomycosis, tinea carries hepatotoxicity risk, requiring baseline and periodic LFTs. Fluconazole also can affect liver, but terbinafine monitoring is emphasized in our X-Files. Hitch vaccine is recommended for all adults 65 years, even if previously healthy. A. Tdap, B. Pneumococcal, C. Hepatitis B, D. Varicella, E. HPV. Answer B. Pneumococcal. Explanation. Our X-Files recommends pneumococcal vaccination for all adults 65 years, PCV20 or PCV15 plus PPSV23 depending on availability. Other vaccines are age or risk specific. Q4. E-present is most associated with QT prolongation. A. Paroxetine, B. Citalopram, C. Fluoxetine, D. Bupropion, E. Duloxetine. Answer B. Explanation. Among SSRIs, citalopram carries the highest risk of dose-related QT prolongation. Monitoring is required, especially in elderly or those with cardiac disease. Q5. Which mood requires serum level monitoring to avoid toxicity? A. Lamotrigine, B. Valproic acid, C. Carbamazepine, D. Lithium, E. Gabapentin. Answer. Explanation. Lithium has a narrow therapeutic index. Serum levels and renal thyroid function must be monitored. Valproic acid and carbamazepine also need levels in some cases, but lithium is emphasized most strongly. Q6. Which atypical anti has the highest risk of weight gain and metabolic syndrome? A. Risperidone, B. Quetiapine, C. Clozapine, D. Ziprasidone, E. Aripiprazole. Answer. C. Clozapine. Explanation. Clozapine and olanzapine have the highest risk for metabolic syndrome. Clozapine also requires monitoring for granulocytosis, myocarditis, and seizures. Q7. A patient with severe COPD into exacerbations is most likely to benefit from adding which therapy? A. Inhaled corticosteroid alone, LABA-LAMA combination. C. Montelukast, D. Theophylline, E. Short-acting beta agonist only. Answer. B. LABA-LAMA combination. Explanation. Our X-Files notes that dual bronchodilation with a LABA plus LAMA is preferred in severe COPD with exacerbations. ICS is reserved for those with asthma-COPD overlap or eosinophilia. Q8. Which of the following is an important T of inhaled corticosteroids in asthma-COPD? A. Tachycardia, B. Tremor, C. Oral candidiasis, D. Hypokalemia, E. Dry mouth. Answer. C. Oral candidiasis. Explanation. Inhaled corticosteroids increase the risk of oral thrush and dysphonia. Patients should rinse the mouth after inhalation. Q9. Which of the following drugs for smoking cessation TL nicotinic receptor agonist? A. Nicotine patch, B. Bupropion, C. Nortriptyline, D. Varenicline, E. Clonidine, E. Answer. D. Varenicline. Explanation. Varenicline is a partial agonist at A4/B2 nicotinic receptors, reducing cravings and withdrawal. Nicotine replacement is a full agonist. Bupropion is a norepinephrine dopamine reuptake inhibitor. Q10. Which antiviral is recommended for influenza treatment within 48 hours of symptom onset? A. Acyclovir, B. Ganciclovir, C. Oseltamivir, Lamivudine, E. Sofosbuvir. Answer. C. Oseltamivir. Explanation. Oseltamivir Tamiflu is effective if started early in influenza. Acyclovir is for HSV-VZV, Ganciclovir for CMV, Lamivudine for HBV-HIV, and Sofosbuvir for HCV. This set covers infectious diseases, psychiatry, and respiratory medicine. Ulti, medium hard, suitable for PEBC Part 1.